Huguley Mobile Health Services began a little over 10 years ago. We started out with a mobile airport terminal bus and $500 and the use of our storeroom at the hospital to gather any supplies we needed. We started out in a little town called Joshua, Texas that had no doctor. Patients started coming. It was a little slow at first. Over a period of about 2 years, it grew so large that we needed to start adding more and more towns within Johnson County. We're now up to 8 different cities, and we see hundreds of patients a year. We start at 8:45 usually every clinic day. When we drive up, a lot of times people are waiting on us, sitting in their car or standing out where we're going to park. We never know what we're going to get. I've had everything from runny nose or a headache to appendicitis, where I had to call an ambulance to get a patient to the hospital. During flu shot season, we may see as many as 1,100 people in one day.
We see everything from children, women's health. We do men's health issues. We see athletic physicals or just for their immunization. And sometimes I'll do a Head Start physical on a child. So really, truly family practice.
My husband's job does not provide insurance we can afford. I come here and get all my medical attention from A to Z, you know, and I would not have that option if it wasn't for the Huguley bus. We've been coming here for nearly 3 years. There's a lot of people in our situation that doesn't have the insurance or the money to pay a doctor, you know, to go visit. And plus, Jana and Joe are great. It's like coming in and seeing family members once a month is what it is.
The people we usually see here are people that have very little income. They have Medicaid or they don't have any insurance. They'll choose between having insurance or buying insurance for their children and not having insurance for themselves.
Used to, before my kids had insurance, we would come here, like, I guess 3 years now about, and they would both get their shots and the well checkup and everything. And then when they got insurance, I started coming here. They just offer a variety of services that are a lot cheaper than going to the emergency room.
We came in here just for a checkup, and my wife had been feeling tired, so Jana said she wanted to, you know, give her a physical. So Jana gave her an EKG, and she found a spot on her heart that didn't look right. So she sent us over to Huguley Hospital, and they found that she'd had a heart attack maybe a couple months ago or maybe longer. We didn't even know it. One spot on her heart was completely dead, and they said that they couldn't do anything for that, but Jana caught it in time where they give her medicine now, and she's doing real good. She's not tired anymore. Yeah. But without this mobile clinic, people would be in trouble that don't have medical insurance. Without this clinic, she would have died. The doctors had told us that. Huguley is one of the best hospitals I've ever been to. We had no medical insurance, and they worked with us, and the doctors waived their fee. We've had ministers come by, and you know, they've asked us if we want to talk to somebody, and all the nurses were very, very religious and polite to us. You know, I can't say enough about the hospital. It's a great hospital.
The mission of Huguley Hospital is to further the healing ministry of Christ, and one of the things critical to fulfilling this mission is ensuring access. The care that we provide on the clinic is provided at low or no cost to the patients that we serve. So it doesn't fully cover its costs, but yet we do realize it's a critical service and important for us to fulfill our mission.
It is important to not only address someone's physical needs, but their mental and emotional and spiritual needs. And I do have an opportunity here at Huguley to share the Lord and do it openly, and to pray with patients, and I love giving hugs. It's one of my special things. I hardly let anybody leave without a hug. And then reaching out to someone who may need a prayer, I know that means a lot to people. I can see it in their eyes and the way they look at me. and the way they maybe have a little tear or something when they leave. They do appreciate it. So that is a big part of our ministry here at Huguley and on the bus.
I believe God chooses people to do certain things. You know, you have the schools and the medical schools and stuff to teach you, but being a faith-filled person, God is your leader, He's your guider. And you have to have the love of God in your heart to work with people like this.
It's grown beyond just a job for me. It's a ministry for me. I've always wanted to do medical missions, and now I get a chance to do it every day. Oh, I can't remember everybody that comes in here. There's so many, but it doesn't matter. I just love them all. They're just like, they are like my family kind of. I felt like that it's the way to treat people. You treat them all the same. It doesn't matter if they have money or they're driving a Cadillac or they came up on their horse. They still need love, and that's what Christ did, and that's what we want to do for them, is love them in that way.
Love one another as I have loved you. And this is the way that all men will know that you're my disciples. Love God's children.